In this and another video, I'd like to talk about how I think LEAF in HRV biofeedback represents a kind of bottom-up revolution. And I think of it in terms of two ways. One is a physiologic bottom-up revolution, and the other is sort of a cultural, political bottom-up revolution. In this video, I want to talk about the physiologic ways in which HRV biofeedback is a bottom-up revolution. What do I mean by that? Normally, in modern medicine and psychiatry, when we think about addressing mood disorders, stress, or anxiety, we think about acting on the brain, going directly to the central nervous system and working on the brain. Medications that affect neurotransmitters, transcranial magnetic stimulation, that's applying a magnetic pulse to the brain, ECT, electricity to the brain, or even talk therapy, which is how we think we address mood or anxiety or other concerns through how we think. With the LEAF in HRV biofeedback, we're doing something quite different. We're starting with the peripheral nervous system, the vagus nerve, which acts on the heart and the intestines and other organs in the body, and goes up and acts on the brain from the bottom up. So a lot of this really starts with the vagus nerve. So I want to talk a little bit about the vagus nerve. The vagus nerve is the most important nerve in something called the parasympathetic nervous system. You've probably heard of the sympathetic nervous system, which is the fight or flight response, the stimulatory part of your nervous system. It has a counterpart, the parasympathetic nervous system, which is responsible for rest and digest, slows the heart rate down, general relaxation response within the body. The vagus nerve runs both directions. It runs from the brain down into our body, including our heart and our intestines, and also runs back up into the brain. Indeed, it projects into a number of important parts of the brain that we associate with mood. So there's a really interesting sort of bi-directional highway on the vagus nerve. In terms of the bottom-up revolution, what heart rate variability does is essentially a way of exercising your parasympathetic nerve through breathing techniques. And that's essentially what we're doing with LEAF, is practicing and enhancing, strengthening the parasympathetic response. So in this sense, in the bottom-up physiologic revolution that I'm talking about, we're really talking about taking an outside of the brain nerve, the parasympathetic nervous system, the vagus nerve, and doing exercises, breathing exercises that bring from the heart, from the intestines, up into the brain, and really have an effect on mood, on depression, on anxiety, on stress, on sleep, and a number of things which I've touched about in other little videos. We don't really know exactly how this works. We think it may work to modify neurotransmitter release. It probably directly affects some of the circuitry in the brain, as it does project directly, as I mentioned, into some of these areas associated with anxiety and with depression and other mood regulation. And it may also affect stress hormone release, which, as we know, also has an effect on mood disorders, depression, and anxiety. Lastly, and I'll be mentioning this in a future video, there seems to be some effect on the general body's inflammatory response. And there seems to be a way in which, again, acting peripherally, moving up centrally, bottom up, heart rate variability is also affecting our body's inflammation. So sort of a long digressive approach, but really I think for us in modern medicine, who have this sort of reductionistic approach, is returning really to a more old idea that the heart, the body, the rest of the body does work from the bottom up and also affect the brain. So ultimately what I'm getting at is, at least in terms of the framing of modern medicine, this really is a bottom-up revolution in the sense that we're moving physiologically from the body into the brain. This may not be revolutionary to people who always had a bit of a broader approach to health and to wellness, but for people in medicine and in psychiatry and in the paradigm we've really been kind of thinking about it in recent years of brain first, it really is a change in the orientation of how we can improve our well-being.